We take you to KwaZulu-Natal, where the Premier held a provincial commemoration event as South Africa marks 1 year since its first COVID-19 case. On March the 5th of 2020, the first case of the coronavirus was reported in KZN after a local man travelled to Italy. Our reporter Karinda Jagmohan is there. Karinda, very good morning to you. There have been some interesting changes and developments since that very day where we learnt of the first case of COVID-19.
Good morning to you. Indeed, they have. I'm actually in the Edendale Hospital. This is one of the vaccination sites in the province, and I'm joined by the Health Minister, Dr. Zweli Mkhize, who has been in the province conducting oversight visits and speaking generally to the public about the year that's been regarding COVID-19. Thank you for speaking to Newsroom Africa, Minister. What a year it's been for everyone. But can you tell us something that South Africans don't know about how this year has impacted you personally?
Well, it's been quite a stormy year. For one, it really has been at a personal level. It changed the way we work, it changed the hours of work, and it has changed the way we relate with family, unable to meet and sit together, and so on. So even when we lost family, relatives and friends and members, the restrictions, the inability to visit the hospital, it has really impacted on us. And as you know, we did go through the infection ourselves, although we believe very fortunate because it was a milder form of infection. But I think that what I feel most is what all South Africans have gone through, to be forced to change our life. For example, the fact that you could have the churches, for people not to be able to go to church, it's a huge thing, and that's affecting them, and so we appreciate that they cooperated. The fact that people could not go to the Easter week church services has been a huge thing, and we really appreciate the religious leaders because they helped us to stop what could have been a huge devastation, and I really thank them for that. When we cannot have ceremonial activities in the villages, difficult issue is when someone is sick and you can't go to the hospital. It's very difficult to be sick alone, and many people have lost their lives in a situation where they were alone. Thanks to the nurses and the doctors who have been there on their side, acting as supporters, as carers, caregivers, as well as family, as friends, to give them the support. The problem of families that cannot go and bury someone. Imagine you couldn't see the person when they were in hospital. Maybe they got called, maybe they asked that you visit and you can't, and you can feel that they need to have the comfort of their families, and they can't do it. And then they pass, and you cannot go and bury them in the normal way, where we go in large numbers, we sing, we comfort each other. We can't do that this time. People who cannot go and watch sport, because today, South Africans every weekend they're out there cheering their clubs, and they can't do that. They can't go to a music festival. They cannot go to visit friends and family. Even if they meet friends, they can't jump at them and hug them and shake hands and kiss them. It's really taken its toll on South Africans, and I think that has been the biggest, impact to our society. Of course, a number of people have lost jobs, businesses that have had to close, people who couldn't cope, and then starvation, loss of jobs, closing businesses, and not being able to travel from one area to the other. And at some point, we had soldiers out there, we had the police out there, and to sit every day and cover your mouth with a mask, and mouth and nose with a mask, and having the distance where you can't talk to people next to you. All of this is what South Africans have gone through, and we want to say thank you for their support and their cooperation, because that's why we managed to defeat the pandemic the way we did. If it was not for that, it would have been much, much, much worse. And we want to say, yes, we've gone through a very difficult year, but there's a hope. The vaccines are here. We have seen the level of enthusiasm for the vaccine. I've just met a number of health workers. They're excited that they're going to get the vaccine. They were the warriors who stood in front, knowing that they could meet the patient. That patient might be the one that will give them the infection. That infection may be passed to their children, to their husbands or wives or members of the family. All of this has been the year that we've gone through as South Africans, and it's a very, very serious sacrifice that South Africans have made to be able to come this far. So we have to say to South Africans, we thank them, we acknowledge what they've gone through. Let's persevere for a little longer. We've got the vaccines coming, more in numbers in April, in May, in June, and in the third quarter, in the fourth quarter, we'll have a lot of vaccines coming through. We'd like people to continue to participate, receive their vaccines, so that we can slowly shed this virus. It's going to take a while, and I think it's important for us to say we must keep our masks on, hand sanitizers and hand washing must continue, distancing must continue, until we can see that the numbers of people who are testing positive has gone. Then we'll know. But we're not the only one. The whole world is going through that. And now with this variant, if we can use our masks, it's important that we continue, because in the next few weeks we can delay the advent of the next wave if we keep to our masks and sanitizers and so on. How we defeated this last wave is because we enforced a lot of that and people were very serious about it, so we've gone out of it. A new wave can come up if we actually are complacent. But the new wave can be deferred further and further, because remember the winter is coming. We're going to be cuddling, sitting close to each other in overcrowded spaces. That's going to cause us a risk of a new resurgence. We're going to have Easter weekend when people move all over and start crowding. The same problem we had during the festive season might arise during the Easter season. So we need to just be aware that we can defer it, we can reduce the impact, and we can delay it. And that is what we suggest people should do. I've been very pleased to see here the station is very well organized. Everyone is very knowledgeable. They're very methodical in the way they do it. The staff is receiving the vaccines from different parts of the province. It's a good start, and I've assured them that there will be more vaccines, and then the numbers will start picking up. We'll have many, many more centers after this. Those many more centers are going to vaccinate millions of South Africans, and that way we'll be able to start the fight to take charge of our own lives and defeat and drive the virus out of our lives.
Minister, I just have a few seconds left, but if you can tell us briefly, when will the ordinary South African be able to receive this vaccine?
From April, we should get the next priority group, which is people with comorbidities, people who are in community services where they are frontline workers, they're like the police, the teachers, the taxi drivers, hotel workers, traditional healers, mine workers. A whole lot of those will come in. We're targeting about 16 million people who must be vaccinated. It should take us about 6 months, but we hope we can get more vaccines so that we can push the numbers up. But what we are really asking our people, religious leaders and all the people who are involved in social activities, must all come in at that time so that we can actually fight to defeat the infection.
Thank you very much. Our Health Minister, Dr. Zweli Mkhize, speaking to us on the, can we say, anniversary of COVID-19 in South Africa. A year ago, he was at the Cowan House Preparatory School in the Midlands, and now he's here in the Midlands speaking about, explaining what COVID-19 was to people, and now he's here speaking about the vaccine and saying that possibly by April, most South Africans will be receiving their inoculations.